Many people ask me about public venous awareness and venous disease, and why should we all know about it? Well, we should know about it because it's been estimated that around 50% of the Western population are likely to get some form of venous disease during their lifetime. This can range from spider veins to more serious complaints such as leg ulcers. This is due to the fact that we have evolved to walk upright, which means that gravity is constantly forcing blood away from the heart and back into your veins. If normal blood flow through the valves within the deep veins in your legs become ineffective due to injury or inactivity, the blood may be redirected to the superficial veins. These are situated near the surface of the skin, causing various complaints such as varicose veins and leg ulcers. It is this extra pressure in your veins that may lead to problems in later life. Blood flow around the heart is vital to our health, but legs play the important role in that process. Pumping by the rhythmic contractions and relaxation of the heart muscle, blood flows around the body via 3 types of vessels: the arteries, the capillaries and veins, ensuring oxygen gets into every living cell and carbon dioxide is released from the body. Blood returns from all of the furthest corners of the body to the heart by the veins, which have the system of one-way valves to prevent backflow. The calf muscle is known as the secondary pump after the primary pump, which is the heart. The calf muscle pump relies on muscle action to squeeze and release the deep veins, creating pressure and encouraging the return of blood to the heart. This gentle squeezing in the deep veins on contraction, for example when walking, muscle activity pumps blood from the superficial to the deep veins and valves. This prevents backflow due to the gravity when the calf muscle relaxes. This assists the blood to travel uphill back to the heart. These valves are quite fragile and in some people they can fail. This failure is more common in some families than others. The failure of the valves in the veins allow backflow of blood into the superficial veins. This floods the veins and raises the internal vein pressure. This is known as hypertension and is known to cause problems such as unsightly varicose veins, brown staining, and chronic venous insufficiency in later life. Many of us are distressed by the appearance of our legs, especially if we have visible varicose veins, thread veins, aching legs, swollen ankles, and discoloured patches of skin. If you are having these problems with your legs, you may well have noticed that the skin has become discoloured, and you may also experience itchiness in the lower part of your leg. These conditions arise from the same basic issue: pressure in the valve vessels that returns blood from the feet and legs back up to the heart. The clinical signs suggest of venous disease is history of varicose veins, deep vein thrombosis, phlebitis, which is known as inflammation, and you can see that on the redness, vein problems in other family members, hardening and brown discoloration of skin, generalised leg ulcers, worse obviously at the end of the day, and ankle flare, where there are little distended small vessels around the ankles, and eczema on the legs, known as varicose eczema. These signs can lead to venous ulcers. Venous ulcers are usually near the ankle, known as the malleolus, although they can be elsewhere on the lower leg and foot. Leg pulses are usually present, but they develop slowly and may reoccur after healing with compression if you've already had treatment. They are often large, shallow and very wet if you do have an ulcer. If you have had any of the above signs, your healthcare team will recommend graduated compression hosiery. Compression hosiery is the recognised gold standard treatment of choice and used to control edema, which is the swelling of your legs, manage varicose veins, and for the prevention and treatment of venous disorders. The hosiery is scientifically designed to improve and regulate the flow of blood in the legs back to the heart, and from the minute you put them on, you will experience the difference. Many people routinely wear these compression stockings and socks simply to relieve tired, aching feet and legs. Others are prescribed graduated compression hosiery by their general practitioner or vascular team, either as a preventative measure for life-threatening conditions such as deep vein thrombosis, or as a therapeutic device to relieve chronic swelling, which, as I've said, is known as edema, or control the spreading of varicose veins. Although the mainstay of venous disease and leg ulcer management has been dressings and bandages, there is increasing evidence that surgical intervention can cure a certain proportion of these leg ulcers and other problems of the lower limb. In those leg ulcers caused by superficial vein problems, 2 randomised trials suggested that surgery to the underlying veins helps the ulcers heal quicker with less chance of them reoccurring. Health promotion is very important in this day and age, but what is it? You may hear the term chronic venous insufficiency, which means your veins are unable to properly transport blood from the legs back to the heart. Venous disease is extremely common and manageable, but if left untreated, what starts as a small issue can potentially lead to problems. For example, venous ulcers and other complications. So what are the signs to watch out for? The signs are that venous insufficiency is described as abnormal blood reflux through incompetent veins. These can cause local damage to affected legs. The symptoms of venous insufficiency can include throbbing, cramping, burning sensations, and leg fatigue. Varicose veins in the legs can bleed since veins are very delicate, structured within thin walls, and often fluid retention, again known as swelling, known as edema. In the lower part of the affected limb and the foot, skin changes can occur and affected areas can become thin, shiny, discoloured, blue, purple, and what we call atrophic. Areas of pale white scar-like tissue that breaks down easily to minor knocks and turns into ulcers. They can be difficult to heal without proper medical attention. The skin and subcutaneous tissues in the gaiter area, the area between the bottom of the calf and of the calf muscle and the ankle, usually becomes thick and stiff, and being inflexible is prone to easily getting damaged. Ankle flare, commonly seen in the inner side of the ankle, is a result of distension of the superficial veins, and they are one of the early signs of venous disease. So what are the warning signs? Well, the warning signs include aching, swollen legs, redness and skin marks from clothing, leg cramps during or after riding or walking, tingling sensation, itchy, dry skin, scaly skin, red patches of skin between the knee and the ankle, which can often, in the early stages, feel hot and are painful and can be misdiagnosed as infection. Raised veins in the lower leg, varicose veins, thread veins. These small veins are presented in everyone, but are not normally visible until they expand and show through the skin. Often these type of veins will appear alongside varicose veins, and people who develop the thread veins have examples of other types of varicose veins in other areas, because both types of vein appearance are probably caused by the same factors. So, who should the patient or yourself go to if you have any of the above problems that I've mentioned, and what should you do next? Well, if you have any concerns about the condition of your legs, even if you don't have exactly the same symptoms as described, it's important to seek advice and or treatment from your local healthcare provider. Clinical specialist in the first instance, that's vital. You should be referred to a vascular team who will monitor you and your legs by conducting a full general health assessment. In the United Kingdom, guidelines from the National Institute of Health and Care Excellence in July 2013 made new recommendations for any person presenting with varicose vein symptoms or skin damage at the ankle, or any patient with a leg ulcer, even if that has been healed, must be referred to a vascular service. During the assessment, you will be asked several questions about your health. This enables the clinical team to ensure that you get the right treatment, help and support. Individuals who are suitable for surgical treatment should be referred for endovenous surgery. All patients, whether suitable for surgery or not, will need ongoing support until healed. Those that have had surgery and are cured may end up being discharged. However, those having surgery and not seeing a cure, or those unsuitable for surgery, will need ongoing long-term support and care. Effective communication with your healthcare provider is key, and you will be advised about the importance of skincare. Discourage self-treatment with over-the-counter products. Avoid accidents and trauma to your legs. Avoid long periods of standing to prevent venous hypertension. You'll be encouraged to exercise and leg elevation for at least 15 minutes every day. This gives your veins a break from their hard work. And wearing compression stockings. You need accurate measurement of the lower limb for compression hosiery. That is essential, and you must follow manufacturer's instructions. If you have problems with putting your stockings on, there are devices available which you may find useful for the application. You must be reviewed regularly and remeasured. It is generally accepted that hosiery should be replaced at least every 3 or 6 months, depending on the manufacturer and your provider.